Hello, I'm Teresa Bird, and I am one of the uh, maternal co-chairs for the GAP-QC, the Georgia Perinatal Quality Collaborative. And today we're going to be talking about navigating the future of cardiovascular screening in pregnancy and postpartum. So I'm going to start off with a case. This is a case of Destiny. Destiny is a 25-year-old African-American G2P2 who is having an in-home doula visit 10 days after an uncomplicated vaginal delivery. Destiny complains of fatigue and persistent cough since delivery. The doula takes the patient's vital signs, which are shown below. Blood pressure is 110/80, heart rate is 126. The doula tells Destiny that she probably has a common cold and that her blood pressure is normal. Fatigue is attributed to lack of sleep. 1 week later, Destiny presents to the emergency department with continued symptoms, and beta agonists are prescribed for presumptive new onset asthma. 2 days later, Destiny experiences cardiac arrest at home, and resuscitation attempts are unsuccessful. Autopsy findings were indicative of cardiomyopathy. And so, unfortunately, we've seen cases like this time and time again. Many of you may also know of a case that's familiar here in the Georgia and Atlanta area of Dr. Shalon Irving, who, after a couple of weeks after her baby was born, had similar symptoms and a similar outcome, unfortunately. And so we're here to talk about these maternal deaths that are occurring due to cardiovascular disease. So that's the WHO. So these are moms that are either pregnant or postpartum. And I want you to ask yourself, have you had a pregnant or postpartum patient who complained of vague symptoms and you told her not to worry? It's very common for us to do oftentimes. And I wonder, how would you feel if she died of a cardiac event shortly after your visit or call? And that's something we all really need to think about. And lastly, how would you feel if you realized her death could have been prevented? And so that's really the goal of this presentation here, is to think about those women and those patients who have symptoms potentially of some type of event that could be occurring, and could we potentially prevent their death? So the objectives of this talk are to discuss the leading causes of maternal death and the time in which postpartum mothers have pregnancy-related risk, describe the signs and symptoms of cardiovascular disease during pregnancy and postpartum, and then to understand the importance of implementing the cardiovascular disease risk assessments and the steps included in screening for cardiovascular disease risk. So we're going to talk about the what, right? So what are we talking about today? So U.S. maternal mortality rates right now are up. As of 2022, it was 22.3 per 100,000, but in 2021, the maternal mortality rate was as high as 32.9 women dying per 100,000 in the United States. And when you look at these statistics by ethnicity or race, Black women have 2.5 times a higher chance of dying than white women. And that was true back in 2021, and the numbers are still elevated in 2022 as well. And if you really look at the age of the patients that are dying, maternal mortality is much higher, 4 to 6 times higher for women who are over 40. So when you're talking about Black women and then Black women over 40, really important that we pay attention to women in this category, because we have much higher rates of maternal death after age 40. And still looking at those statistics, most recently, these were updated in the Georgia maternal mortality statistics specifically. All cardiovascular conditions as of 2022 were the #1 cause, 28 of the deaths here. And what's important to notice is that 87% of these pregnancy-related deaths had at least some chance of being prevented. And that's what we want to focus on today, prevention. Can we potentially identify women at high risk of dying and then intervene before they potentially succumb to a catastrophic event? And so another thing that's really important to know is, when were the deaths happening, right? So most of us were focusing on while the patients were pregnant, but that's a small percentage of the patients looking at the data from 2019 to 2021. The vast majority of the deaths were happening postpartum. So between 1 day and 1 year postpartum, you're having almost 60 to 70% of the deaths happening during that time, right? So 71% of the deaths were happening in the postpartum period, 21% of those deaths between days 60 and 365. So remember, most of those are going to be clustered around the 1 week post, 1 day to 1 week postpartum up to 60 days. But then even when you get past 2 months out, you still have some patients, you have 21% of patients that still had a death occur during that time out to 1 year postpartum. So really want to pay attention and focus on the postpartum period to make sure that we are paying attention. And as I know that we have mostly doulas that are taking part in this training today, I just want to reiterate that we're focusing on giving you this information so you can take it back to your patients, but really have a heightened sense of awareness about any conditions that can present during the postpartum period, so that we're not just focusing on the times when moms are pregnant, but also focusing on the postpartum period as well, when most of them will present with these symptoms. So now we'll talk about describing the signs and symptoms of cardiovascular disease during pregnancy and postpartum. So this is the what, right? Cardiovascular disease in obstetrics. So in pregnant and postpartum patients. So what cardiovascular changes occur during pregnancy? We all know pregnancy is a cardiac stress test, right? So it's like, I tell my patients, it's like your body's running a marathon for 9-10 months, right? There's significant physiologic changes that occur during pregnancy, and every system in the body adjusts to accommodate this pregnancy. The cardiovascular system has many changes in the heart rate, changes in the heart structure and muscle itself, but the pulse, cardiac output, and total blood volume. So some of these that we see, so there's an overall decrease in the systemic vascular resistance related to pregnancy hormones. So that ends up in a decrease in blood pressure kind of mid-pregnancy, but then it goes back up to normal or higher later on at the end of pregnancy. The heart rate actually increases about 10 to 15 beats per minute above the normal baseline. It can be even higher in patients with multiples, so like twins and triplets. And then the blood volume increases up to 50% by the third trimester. So that's 1.5 liters, right, to maintain blood flow to the uterus and the fetus. So remember that increase in your heart rate and that increase in your blood volume all have contributions to how we end up with problems and changes during pregnancy and postpartum. So question here, what is the most common presentation of cardiovascular disease during pregnancy or postpartum? Is it dyspnea or shortness of breath, palpitations, chest pain, or swelling of the legs and feet? And contrary to what probably most people know or believe, the answer is actually shortness of breath. So most of your patients are going to present with shortness of breath or dyspnea postpartum and during pregnancy. And we always tell a lot of our patients, oh, that's just because your belly is growing. It's pretty normal to have that. Or we kind of shoo off those symptoms and kind of reassure patients that they're okay. But that is a symptom that we really shouldn't be ignoring, because that can be the presentation of cardiovascular disease during pregnancy or postpartum. So then if we know kind of what's happening and what's going on, why are we missing the mark? Why are we not improving maternal mortality related to cardiovascular disease? And I want to focus on the number one reason. And the number one reason we are is because we have a delay or inadequate response to clinical signs and symptoms. So just like we just talked about, those patients that have shortness of breath, we tend to just, shoo off those symptoms and kind of play them off and say that they don't really have as big of an impact on the patient, or we chalk them up to something that's really not that significant, not realizing that we're missing patients that may be presenting with cardiovascular disease. Of course, there's also ineffective or inappropriate treatment, misdiagnosis, failure to refer or consult. But again, we are going to focus on the delay and inadequate response to clinical signs and symptoms, because as doulas, you guys know, you may be the first person to touch the patient, the first person that a patient actually complains of any symptoms to. So we want to make sure that there's no delay and there's no inadequate response to clinical signs and symptoms. Some other important points: for some women, the first presentation of cardiovascular disease may be during pregnancy or early postpartum. So don't just assume because the patient doesn't have a history that, oh, she can't have anything presenting. Actually, pregnancy could have been the perfect stress test to stress out her heart and put her in a space that she actually will present with symptoms, and that cardiovascular disease will present for the first time. Usually between 24 and 28 weeks or postpartum is the time with the greatest risk for worsening symptoms, right? So worsening cardiovascular symptoms are when those patients have those really increased heart rates and they have all that extra fluid in their blood volume, right? And so during that time and then postpartum, because remember, now you don't have the baby postpartum come in the placenta to use up all that extra blood volume that you have, but that blood volume didn't just go away as soon as you delivered the baby. Yes, you have some, bleeding that you had initially there, but you don't lose that much. We don't lose 1.5 to 2 liters of blood at delivery, hopefully. And so because of that, that blood volume and that shift has to go somewhere. So your body has to accommodate that for a period of time until that blood volume decreases again. Cardiovascular symptoms or vital sign abnormalities should not be ignored in a pregnant or postpartum patient. And then screening all patients who are pregnant and up to 365 days postpartum can help identify those at risk for cardiovascular disease. So really thinking about screening patients all the way to a year after they deliver to identify patients at risk. And so again, we're going to focus on the benefits of screening for cardiovascular disease, specifically increasing patient and provider awareness, right? So if providers are more aware, they're more likely to include cardiovascular disease in their differential diagnosis, right? So when patients do show up at their office or patients do show up at the emergency room, they're not just shooing off those symptoms and downplaying those symptoms because they think, oh, this is just someone and she's complaining of this, but it's really not anything. So they're remembering to think, oh, this patient was pregnant this past year, or she just had a baby. That's going to make sure that they keep cardiovascular disease on their differential. And then having patients be more aware. So even if the provider's not aware, if the patient is more aware, then they're going to be more likely to seek care, right? Instead of staying home because they're like, oh, it's nothing. I don't want them to tell me that it's nothing, so I'm just going to stay home. Have your patient be keenly aware of the signs and symptoms and the times at which they are at risk, and really letting them know that you're still at risk until your baby turns a year old, or until it's been 1 year since delivery. And I want to just highlight one other thing as well. Some of your patients may have delivered a baby, but the baby didn't make it, right? Or some of them may have miscarried, right? Or had a stillbirth. So it's really important to also remember to ask these questions of your patient if they were pregnant in the past year, because some of them may not be as forthwith coming with this information because, it was a bad outcome. And so remembering to ask your patient these questions if they were pregnant in the past year is important as well. And then, of course, another benefit of identifying patients at increased risk that leads to appropriate follow-up and ability to do further testing. And then, of course, if we have the opportunity to modify risk factors, and we could do that, right? So maybe we can decrease their long-term risk of cardiovascular disease as well. So another question here, which biomarker has been shown to aid in the diagnosis of heart failure? Is it B-type natriuretic peptide, also known as BNP? Is it C-reactive protein? Is it creatinine kinase, MB? Is it troponin? Is it lipoprotein-associated phospholipase, A2? So of those, which biomarker has been shown to aid in the diagnosis specifically of heart failure? And the answer is B-type natriuretic peptide, so BNP. Clinical uses of BNP in pregnancy include helping with the diagnosis of heart failure. And they've shown that in pregnant women with dilated cardiomyopathy, higher BNP levels predicted adverse cardiovascular outcomes. So these were the patients with the higher BNP levels who you knew potentially were going to be at higher risk of having a cardiac emergency and potentially even a cardiac death from cardiomyopathy. So using the BNP was helpful. And then also asymptomatic left ventricular function. So that's a portion of the heart that really pumps to get the blood out to the rest of the body. In patients with asymptomatic left ventricular function, so maybe they didn't have any symptoms, it was useful in evaluating shortness of breath. So remember, again, in those patients, you're not really thinking, oh, she doesn't have chest pain, she doesn't have all these other signs, but she comes in with shortness of breath. Maybe we need to get the BNP to evaluate whether or not this patient is at risk, right? And then it's also a predictor of cardiovascular outcome. So in patients, in pregnant women with congenital heart disease, higher BNP levels were also associated with poor outcomes. So just a reminder that BNP is a specific test that really helps in the diagnosis and kind of the evaluation for heart failure. And so it is a simple lab test that can be used in the right patients to help identify patients at highest risk of a cardiac event and potentially cardiac or maternal mortality. So you always want to think about pre-existing cardiovascular disease and or new onset peripartum cardiomyopathy may initially present during pregnancy or in the postpartum period. So it may present for the first time during pregnancy or postpartum. So don't think that just because they didn't have anything before, they can't have it now. Physiologic changes associated with pregnancy usually return to normal by 2 weeks postpartum. So if you have a patient that is getting worse and not getting better after delivery, that should be a huge red flag to you to say, well, wait a minute, this lady's complaining more about shortness of breath. This lady's complaining more about swelling in her hands and feet. This lady's having more difficulty breathing and doing kind of normal things in the house that she didn't have before. And you would assume that she should be getting better and better every day after delivery instead of feeling worse. And then peripartum cardiomyopathy most commonly presents in the first postpartum week, with 75% presenting in the first month. So really, peripartum cardiomyopathy is another form of heart failure. And most of your patients that present with this are going to present usually in the first week after they deliver, but most of them, 75%, will present within the first month. So really have a heightened sense around that time as well, because you'll see a lot of patients present at that time with these symptoms. And this is a prime time not to exclude shortness of breath as just a minor symptom. And then pregnant or postpartum women with cardiovascular disease frequently present with shortness of breath or new onset cough. So again, new onset cough, patient starting to cough, don't start thinking, oh, does this patient have asthma? Really uncommon to be diagnosing, adult onset asthma right after delivery and not thinking about these other things, right? So really have to keep it on your differential that this is potentially cardiovascular disease. And then remember shortness of breath. Remember things like if the patient has to stop to breathe in between sentences, like if she's talking and then she has to catch her breath and then continue her sentence, that's again shortness of breath at rest. That shouldn't be occurring. So if you notice that in a patient, or she tells you, I'm really short of breath, I can't breathe the way I normally could, or she starts to have a cough and she's kind of coughing all the time and she's not got a fever and other signs or symptoms of an infectious process, really keep that cardiovascular disease on your differential. And when a woman presents in the postpartum periods with complaints of shortness of breath, ask if she has experienced, worsening level of exercise tolerance. So has she been able to go up and down the stairs without a problem, and now all of a sudden it's difficult, right? She has to stop, the first 2 steps and then take a break and then go the rest of the way. Or difficulty performing daily activities. Maybe it was easy for her to pick up the baby and carry the baby in the carrier around the house, or maybe it was easy to carry a load of clothes in a clothes basket to the laundry room, and then now she's having difficulty. Again, if the symptoms are getting worse, are they deteriorating? Is she also having chest pain, palpitations, or dizziness? So this could be signs of something else. It could be signs of a heart attack, which can happen in this period as well. So chest pain, dizziness, palpitation, these things can also accompany signs or symptoms. As we said, a new onset cough or wheezing, pedal, so those lower extremity swelling, edema, if it's improving or it's getting better. So it's quite common to have some lower extremity swelling in patients, especially right after delivery. They'll have that swelling in their legs, but it should start to get better. They should start to reabsorb that fluid and start to pee out some of that fluid. And so it won't be in their intravascular space. And so you should see it getting better. If you notice that it's getting worse, her legs are getting bigger, really start to think, is this something cardiac? And then unexpected fatigue. So again, she needs to frequently stop when she's walking. She can't go up a flight of stairs anymore like she did in the recent past. And she lie flat. Is she able to lay flat on her back and sleep? So often what we call orthopnea, and we'll talk about that later, but orthopnea is the inability to lie flat without feeling short of breath, right? And so we talk about that usually in the context of how many pillows do you have to sleep. If she tells you I have to sleep on, 4 pillows propped up, or I have to sleep sitting up, that's a huge red flag, because this patient is having, usually they have signs or symptoms of feeling like they're suffocating or even drowning. And so that can be a sign that they're building up fluid in their lungs and put them at risk for cardiovascular disease, but that could be one of the tip-offs, right? If they're failing to lose weight or they have an unusual weight gain, right? So if they are gaining weight in the postpartum period, that should be a red flag. So if she tells you, I checked my weight, the last couple of days and I've gone up a couple pounds, that should concern you because her weight should be decreasing day to day. Most of these patients will lose more and more weight on a daily basis. And so to have somebody increasing their weight after delivery is odd. Or if it's during pregnancy, gaining a lot of weight in a short amount of time, so more than a pound a week, then you start to worry, are they putting on too much water weight? And is that because of water retention? And is that because of cardiovascular disease? Of course, if they have a history of cardiac or pulmonary conditions, you should be concerned. If they have a history of substance use or tobacco use, so alcohol, drugs, tobacco, all of these things put them at risk for increased risk of cardiovascular disease in pregnancy and postpartum. And then another key thing is if the patient has gone to multiple doctor's offices or emergency departments since giving birth. So what we have found in a lot of the women, unfortunately, that died in the year postpartum, a lot of the cases, the patients had gone to multiple ERs or urgent cares before they actually died. And so sometimes these women are just looking for someone to be able to diagnose what is going on. And I will just caution you that a new mom, a new mom, especially that has a baby at home, or even one that doesn't, right? If she had a stillbirth, no mom wants to have to come into the emergency room and deal with, sitting there for hours and essentially trying to figure out what's going on and doesn't really know. So if she is showing up, really take her symptoms seriously and think about whether or not this could be a cardiac condition that is presenting. So here are some magnets and refrigerator magnets that we have and some cards that we have available that teach patients about the warning signs. So this is for patients about cardiac warning signs. So it's the peach card. It tells them about palpitations, edema or swelling in the hands and feet, abnormal breathing, chest pain, and high blood pressure. These are things that they should all look for. These are signs and refrigerator magnets and cards that they can keep in their wallet or put on their refrigerator, remind them of the symptoms, and keep them with them for a year to really make sure patients and their families know about the warning signs. And so now we want to talk about the screening algorithm. So cardiovascular disease screening algorithm or tool. And if you notice, a lot of these slides have the California Department of Public Health and the California Maternal Quality Care Collaborative logos on the slides. And some of these slides were taken from them. But in California, the CMQCC, Dr. Afshan Hamid, developed a screening tool. And they used this algorithm to apply to 64 of the deaths that occurred in California from 2002 to 2006. And what they found is that 56 out of the 64, so 88% of the cases of maternal mortality or maternal deaths could have been identified beforehand if this screening algorithm was applied. And that detection rate actually increased to 93% when they restricted it to cases of patients that had symptoms. But even if you applied it to all patients, even if they had no symptoms, 88% of those cases of moms dying would have been identified before. So 8 to 9 out of 10 deaths could have been prevented potentially if they had been identified ahead of time. And so that leads us to the who, how, and when, right? So ACOG, the American College of Obstetricians and Gynecologists, has actually put out a statement saying that patients should be referred for a higher level of care and why risk assessment is indicated, right? So why is screening even indicated? And it talks about who should be screened. It says that all women should be screened. And when should they be screened? They should be screened antepartum and postpartum, right? So during pregnancy and after pregnancy, right? And they should be screened how? Using the California screening tool, right? So the screening tool, the screening algorithm that California has developed. And so this is that screening algorithm. This is a modified version. There was a different version that came out before that kind of had 2 phases to it, which we do still use. But this is a simplified version. It's also been adopted by the American College of Emergency Physicians, specifically because it kind of simplifies everything into one basic step. And basically, if you want to scan that QR code there, it'll take you to a digital copy of this, which you can keep and have access to. And I would encourage you to do so that you have access and can use it. And then when you look at it, it focuses on red flag symptoms, right? So these are in patients that we know that are either pregnant or postpartum, right? So up to 1 year postpartum, we're specifically looking for red flags. And I'm going to focus for the doulas here. I'm going to focus primarily with the column on the left because that talks about primarily symptoms. And for most of you, your patients will have a blood pressure a blood pressure cuff so they can take their blood pressure and also get a heart rate. And so we're going to focus on the left-hand side for our doulas here. And so always thinking of shortness of breath at rest. Remember what I said, if she's having to stop to take breaths in between her sentences, if she is needing to stop when she's walking around the house and take a breath, or stop from walking up the stairs, halfway up the stairs, she has to stop and take a breath. Those are important. If she's having chest pain at rest, remember, you always get concerned about pregnant patients and postpartum patients can suffer from a heart attack as well. So really important, or dissection in their cardiac arteries. And so that's important. And so patients may complain of chest pain or kind of with a ripping or tearing kind of quality, right? Palpitations. So are they having palpitations or feeling like their heart is skipping a beat? And is it associated with kind of feeling faint or dizzy, right? Are they feeling like they're going to pass out? So those kind of symptoms. Severe orthopnea. And so again, this is where we talked about orthopnea is actually when your patient says they cannot lay flat, like to sleep. So if they lay supine, if they lay down on their back, do they have to sit up because they're short of breath, right? So if they do, ask them, how many pillows do you have to sit propped up on in order to feel like you can breathe? If they're telling you they have to sit propped up on 3 to 4 pillows, that's going to be considered severe orthopnea, and those patients need to be evaluated. And then, of course, if they have a heart rate that's above 120 or greater, or if they have a blood pressure where the systolic blood pressure is greater than or equal to 160, or less than 90. So you're going to want to think about patients in these categories, right? So look at that, and that's going to be the top number on your blood pressure cuff. That's going to be the systolic number to really look and see if your patient has any of those. And then, of course, any other signs and symptoms may be a little vague, but are they complaining of dyspnea? So that's pain with breathing, right? Edema or swelling in the legs or the hands or feet, right? A cough, a new onset cough. Change in exercise tolerance. Remember what I said. Remember going upstairs. Are they able to do the same things they used to be able to do? And then P&D, that's also when patients are sleeping at night and then they wake up really abruptly feeling short of breath again, like they're suffocating or like they can't breathe. So again, these are the red flag symptoms. If your patient has this, the next step really is to get a key workup. So this patient, for you guys as doulas, if your patients complain of any of those symptoms, then you should direct them to go to the nearest emergency room or go to the emergency room at their hospital and be evaluated. And the key workup is going to be really an EKG, so looking at their heart and the heart rhythm, and then a BMP. So remember that test that we told you that looks at heart failure, that B-type natriuretic peptide, and a chest X-ray. And then plus or minus a troponin. Troponin is another blood test that actually helps identify patients that are having a heart attack. And so those are going to be your patients who may have chest pain associated with it. So usually if the patient also has chest pain, then we recommend also a troponin as well. But really honing in on that key workup, making sure your patient gets to the hospital, gets evaluated, and gets those 4 things done, those 3 to 4 things done if needed. So we're going to go back to our case to Destiny again from the beginning, right? So we have Destiny. She's a 25-year-old African-American G2P2 patient who has an in-home doula visit with you 10 days after an uncomplicated vaginal delivery. And she complains of fatigue and persistent cough since delivery. She's just got a nagging cough. You take Destiny's resting vital signs, which are shown below. She's got a blood pressure of 110/80, and her heart rate is 126. And remembering your doula training, you use the cardiac emergency screening tool and direct Destiny to go to the emergency department for further evaluation. So you say, we had this training and it talked about, having a cardiac emergency and your heart rate is above 120. So you should probably go to the hospital to be evaluated because you could be having a cardiac emergency. So that's the patient now screening positive or at risk for a cardiac event, right? Now what? Is this the tip of the iceberg? What do we do? And so the patient also, when I talked to a lot of the doulas that work at my hospital before, they started sending patients to the hospital, but then told me that a lot of the patients were getting sent back and weren't getting a full workup because either their symptoms were dismissed or they did, 1 or 2 little, an EKG, but maybe they didn't do any blood tests, right? So the patients are saying, well, what do I say when I get to the emergency department? Destiny really wants to know, when I go there, what do I tell the emergency provider? And so what's really important is remember that key workup, right? So remembering that they need that key workup, that EKG, BMP, chest x-ray, and then if they're having chest pain, they also should have a troponin drawn, right? But remembering that BMP, that EKG, I try to identify patients at risk of heart failure because those are the patients that are most at risk of dying. And so this is something that was developed because patients were coming back saying, I went to my provider, but they ignored my symptoms, or I went to my provider and they checked other things, but they didn't check, they didn't check to see if I had a cardiac emergency. And so patients may request a cardiac emergency evaluation. So we have these cards available. You can scan the QR code, take your phone and scan the QR code now for a digital copy of this card. And feel free to give the digital copy that's available online to your patients so that they can show it to their provider. You can also order these, but the key is they should read or show this to the provider, to the emergency provider. So on the back of the card, it says, I am pregnant or I was pregnant in the past year, and I'm having symptoms of a possible cardiac emergency. Please evaluate me and consider ordering an EKG, chest x-ray, BMP, and troponin. And again, it's really vitally important to give the patients the language, because maybe if the provider themselves doesn't know that the patient's at risk for this, just having them say this themselves may prompt the provider to say, hey, you know what? I did forget about that. These patients are at risk of cardiac emergencies in the year postpartum. So let me remember to do that, and let me remember to do a full workup. So at the hospital, Destiny shows her provider her Check My Heart emergency card, and the provider orders a chest x-ray, EKG, and NT-proBNP. Chest x-ray reveals mild pulmonary edema, and the EKG is significant for sinus tachycardia. The NT-proBNP is high, and so an echo is ordered. The echo reveals heart failure, and cardiology is consulted. Destiny is admitted to the cardiac care unit and is treated for peripartum cardiomyopathy and remains in the hospital for 4 days until discharge home. Destiny is followed by cardiology every 3 months, and you continue to see her at monthly home visits. Destiny invites you to the baby's 1-year birthday party. So just showing you here how you really can change the trajectory of someone's life simply by noticing symptoms, not waving off those symptoms as something insignificant, and sending them with the appropriate language to the emergency department to be evaluated, and identifying something that essentially could have prevented her death. And so really important, but a much better outcome than what we've seen previously before and time again. So really wanting to see these positive outcomes because of intervention ahead of time. And so just a reminder that red flag signs or symptoms require immediate evaluation. So if you go back to that screening algorithm, look for those red flag signs or symptoms and get those patients immediately evaluated. So key points: symptoms related to physiologic changes of pregnancy should be getting better in the postpartum period, not worse. And then visits to the emergency department for shortness of breath should raise your suspicion for cardiovascular disease. So have a lower threshold to think about cardiovascular disease. And if your patient has that shortness of breath at rest, go ahead and order that EKG, that BNP, and chest x-ray. And then if she also has chest pain, of course, add in that troponin. And then postpartum dyspnea or new onset cough is concerning for cardiovascular disease. And so how do we screen patients? So again, this is that provider screening algorithm. Scan the QR code on the screen, which will take you to a digital copy of this. You can, if you're a doula, you can, keep it on your phone so that you know the signs and symptoms, and I would encourage you to do so. And when you go to visit your patients, remember to look at that red box, to look at those red flag symptoms, focusing on the column on the left specifically, and then reminding your patients about what they need for workup, right? And so those key workup things, the EKG, the BMP, the chest x-ray, plus or minus the troponin. So we also provided this. This is kind of the old version of the screening tool, the initial version that wasn't combined into one. So it's on a badge buddy that you can have, and you can order these. I actually keep these, this version, because it was the first one that we started with, but you can use it kind of front and back to help you identify patients that need to have that screening. So you can have it on a badge buddy, and if you wear a badge when you go in to see your patients, but many of you are going to your patients' homes and they already know you, so you're not necessarily wearing a badge there, but if you happen to, you can get this to help you have something there in person. You could put it on your keychain to help you remember, but an easy thing to do is literally put it on your phone. The QR code that I just had you scan, you can just pull that up when you go in to see the patient and make sure that you are thinking about those questions and those parameters. And then where do you screen? Basically anywhere. So, and at home is really important here, right? In the postpartum period, we really want to ensure that we are thinking about our patients specifically at home, because this is where many of them will either ignore symptoms and not want to go in because they got kids at home, they got a new baby, they don't have anyone to watch them. They'll find every reason not to go back in and be evaluated. But this is exactly why we want our doulas to be keenly aware of the signs and symptoms and strongly urge patients, if they have these symptoms, to go in to be evaluated. Again, here you can scan this QR code. This will take you to our Gap QC landing page with all of our resources that you can purchase. So whether you want to, if you want to order some of the refrigerator magnets for your patient, the peach card magnets, or the peach cards, which are peach cards that you can give your patient in your wallet. If you are associated with a hospital, I would encourage you to get with your hospital OB department, because they may have ordered a lot of these already. We have been giving these to our doulas to give to the patients with their blood pressure cuffs. And then, of course, also the check my heart emergency card. That's going to give them that language. So you can go here. This will take you to the landing page to order physical copies of these, whether they're the refrigerator magnets, whether they're little cards, whether they're pocket cards or wallet cards that they can have, or for you, for the badge buddies, if you wanted to order badge buddies of the screening tools, you can order those as well, or posters. And then here are just some social media videos that we have created that we will be posting later on, but you guys can scan them here and kind of keep them linked on your phone. That is something that you could show your patients to help educate them about the warning signs and about what things to say and ask for when they go to an emergency room. And so I'll give you a second here to scan these QR codes. Again, scan these, bookmark them on your phone, add them to your home screen, and then feel free to show them to your patients and make sure that they understand, show them to their family members, right? So anything to help them remember. I often tell the warning signs to, of course, partners, right? Because they're usually very aware of differences in their partner, right? So I show it to their partners, but also if they have older children, so if they have older kids or children, you know, kids say the darndest things. So they'll be the ones to say, well, Mom, why are you breathing so hard right now, right? Why are you having to, you know, stop going up the stairs? And so you can't carry, you know, the clothes basket anymore. So they'll really start to notice these things. And if you have kids that are going to prompt and say, Mom, I think you need to go to the hospital, whatever we can do to make patients and their families more aware is what we should be doing. So scan these 2 QR codes to these short little 1-minute videos. They're quick little videos that are like on can be posted, and we will post these on like Instagram and social media, but these are meant to help your patients understand the signs and symptoms and know what to say when they go to an emergency room. And so with that, I want you to take away that you need to take patient complaints seriously and realize that cardiovascular disease maternal deaths may be prevented with earlier recognition, referral, diagnosis, and treatment, right? So if we get those patients in to be seen earlier, don't ignore their symptoms, we potentially can prevent maternal deaths. And you guys as doulas are uniquely positioned to help save lives by screening postpartum. So many of the hospitals and institutions are now using you guys and putting you guys to work, really touching these patients directly. And many of you are doing postpartum home visits with your patients, and hopefully you're able to do these potentially up to a year postpartum, but really being that first touch point for patients to be able to say, are you having symptoms? What's going on? And really urging them to go back, know the warning signs, go to the ER if needed, and then educating patients on the warning signs and kind of what to say when they present to the emergency department. And then last, like this doula did for Destiny, hopefully you can help change a mother's destiny and ensure they make it to their baby's 1-year birthday. So with that, I hope that you guys really take this, and I use Destiny as her name with that intent to show that you can change a woman's destiny and really hope to potentially save lives by simply being aware of signs and symptoms, making patients aware, and then directing them to get emergency care when they need to. So thank you so much for this. Please continue to go out and care for these patients and be the support people for patients and identify women at highest risk of having a cardiac event. And I hope that we can together save lives by just getting patients to realize and get the care that they need. Thank you.